Hello, Osama. It's very nice meeting you today. Thank you for your time. And I really appreciate this opportunity to learn more about the region, the United Arab Emirates, and the opportunities for the business, for investors that are coming to the region and maybe looking for some new areas they can explore. And today, I really like to shed some light on what this region can offer for investors, for biotech and healthcare organizations which want to expand there, some unique challenges, and unique opportunities, etc., etc. And first of all, can you please tell me a little bit about yourself and what exactly you do and how you represent this community?
Thank you very much. So, thank you very much for having me in your program and to introducing me to your community. My name is Osama Elhassan. I'm a software engineer by training. I did my PhD in computing back in the end of 90s, and then I did a advanced master in computing from Imperial College, UK. And I spent some time in academia, and then I from that with getting a PhD in socio-technical systems from University of Leicester, UK. That was around 2008, 9. And then I decided to leave academia and join the industry for healthcare, especially digital healthcare. I joined initially Dubai Healthcare City for 3 years, and afterwards I joined Dubai Health Authority, starting from 2012. I joined a team who was focusing in developing and architecting and implementing the digital health strategy for the Emirate of Dubai. That includes two or three main pillars. One of them is building the health information exchange platform across the city, building also the digital health governance framework. That includes legislation, policies, and also building the digital health licensing framework, which is now up and running. And as we speak, we are licensing digital health platforms like telehealth, whatever. Apart from my work with Dubai Health Authority, I was very active in the NGO space. So I'm the vice president of the Emirates Health Informatics Society. I'm also the co-founder and president of the ZIMAM, which is an NGO focusing on digital health workforce development, which is based in Geneva. However, we are focusing on GCC and MENA region. Thank you.
Yeah. Thank you very much. Well, impressive career path. Uh, well, actually, we first met during the recent climate conference in Dubai, COP 28. So I was impressed by the level of the event. Like it was extremely useful to be there, meeting all the people. Lots of companies, transnational brands were there. Companies like Microsoft, various digital health companies. Uh, a lot of folks obviously they wanted to explore opportunities. And can you maybe outline some reasons why Dubai and United Arab Emirates have become so attractive lately, and how did you manage
Well,
to build
actually,
this?
if you look into the history of Dubai as a city, it was run since early 20th century as a company. So even the main entrepreneur in Dubai will be the ruler of Dubai, and he runs the whole government as a business. And he focuses on making Dubai as an attractive land to all businesses, to all entrepreneurs. They listen to them. They cherish their wishes and dreams, and they help them to realize them. That's what is unique about Dubai. And Dubai moved from being a classic hub for just trade and exchange of goods. And they realized since maybe 80s and early 90s that digital economy is the future, and they focus on building the right infrastructure for that by bringing the right talents, by bringing the right infrastructure to help companies to flourish and to excel. Yeah, so that's the general theme for Dubai. We also in healthcare, also we focus on supporting the private sector, especially in healthcare. So if you see Dubai today, it's really booming in terms of providers, insurance, and even companies who are working on digital health. They think that Dubai is the right hub for them.
Let's say there is a company in healthcare, or let's say a digital health provider of sorts, and they want to expand into this region, into Dubai, and offer something. What might be the benefits of doing that? Like, what are specific benefits? Maybe some policies or tax or financial benefit, whatever. Can you outline
I think
something?
the key factor that makes Dubai very attractive is the ease of establishing business, the ease of connecting to with government entities who are regulating this domain. Talking about digital health, for example, so Dubai Health Authority is the regulator for digital health. So we have some sort of a framework that allows new companies who are coming with new ideas, with new, I think, yeah, like disruptive ideas to come to us. We look at their model, their ideas. We have some sort of a clear pathway to embrace them, to learn from their expertise, and even sometimes to alter regulations and policies to allow them to work in the right manner. So that's one thing. The second thing that Dubai because is already becoming a hub for the whole region, and everyone looks on what Dubai is doing. So by implementing your first POCs or use cases in Dubai, that will help you work harder. And this
Okay.
will give you attractions in and other countries in GCC and MENA region.
So relocation to Dubai. Let's talk about talent. As I might imagine, it's a lot of folks who come to Dubai for work, making business, new technology entrepreneurs. I imagine a lot of folks with healthcare background or technical background. Uh, but in general, how hard it is to find for a new company establishing an office there, let's say, how hard it is to find talent locally, or they still need to bring talent teams with them to that offices in
No, I
Dubai.
think because Dubai, the lifestyle of Dubai and the ease of being part of the digital health ecosystem, that will attract many people to come to Dubai. A lot of people are actually dreaming to come to Dubai. So today, if we file a record for a position, we find thousands of applicants trying to get into it. So that's the most attractive part, that the lifestyle in Dubai and the ecosystem of Dubai is very cosmopolitan. It's very easy for you to bring your family, to raise them, to get school to them. So that makes Dubai really very attractive comparing with other cities. So because of that, and finding talents is not a problem at all.
Mhm. Yeah, I can only confirm my really great, feeling when I was walking in streets and basically visiting all that high tech stuff. It was really like future is here, and it looks kind of good. So for the companies, especially, if it's not a startup, let's say we talk about a large corporation which wants to expand their business. So they're already doing business somewhere, let's say in the UK or in the United States or in some Asian countries, and then they want to establish presence in Dubai. Will they meet some regulatory burdens or mismatch with existing regulations, because obviously Dubai has very different regulation from the UK, let's say. Do you have some
So we
statistics?
have some few special regulations that we have in our region. Specifically, we're talking about data. So most of the GCC countries are focusing mainly on what we call data residency. and that makes life a little bit difficult when we want to transfer data outside of the country. So there are
Uh-huh.
very strong restrictions around that, and that require that all those companies they need to invest in infrastructure within UAE to host their applications and their data. That's maybe one key difference between the legislative process in UAE and other European countries. So you need to invest a little bit on building your, I can say, infrastructure within the country and try to your best to minimize any transfer of data outside the borders. Yeah. That's one of the key issues that we have. Other than that, I think we have a very flexible system. Even the taxation system is very reasonable comparing with other countries as well. I don't see any different other difference.
Okay, so data regulation, data privacy, that's the about establishing companies or the requirement for local directors or local people working. Are there any limitations like that, for example?
They're
Do
very shallow. I think we've just introduced new legislation around having UAE citizen working in one organization, and then the ratio is very limited. I think it could be 9 to 1 or something like that, which is not a restriction at all. Yeah.
Okay, okay, sounds very attractive actually.
Mm.
I've met with representatives of in silico medicine, for example. That's the kind of cool startup which is now in the United Arab Emirates, and that's the representatives of the biotech community, drug discovery community. But what I heard is that they find the place very attractive for the team, for especially for the digital team, the folks who do
Yeah, so I
some
think Insilico is one
computation.
of the good examples of international company who decided to make Dubai or Abu Dhabi as their main headquarters. And fortunately, they got a very good support from the government, investment from the government, and it's always becoming like their first buyer as well. So that's a good example.
What other examples can you maybe give from the digital health? Some in common brands or companies.
So I can give examples of some companies who originated from Dubai. So I can give you an example of a company called Okadoc. So Okadoc was started from an expat who came to Dubai and decided to get into digital health, and now it's becoming one of the most successful telehealth platforms and appointment booking platforms in healthcare. And they are doing a great job, not only in Dubai, but even they are expanding outside to Saudi, to US. So that's a very good example of
Mhm.
companies who originated from Dubai, but developed by an expat.
Well, that's it seems like the ecosystem is welcoming. What I can see from what you're saying, and from my experience with other folks I've been meeting during my visit, and but maybe about let's talk about challenges. Because the picture is of course great, but challenges might be important to tackle. Can you maybe outline what you imagine might be challenging for a new company, especially, let's say Western
I
company
think,
or Chinese company?
ironically, some of the challenges that we have are actually creating more opportunities to companies. So one example for that is the complexity of the healthcare ecosystem. So despite the fact that we are only a 10 million nation, however, we have a very complex healthcare system that includes three healthcare regulators. So we have a regulator in Abu Dhabi. So Abu Dhabi has a separate regulation territory. Dubai has another territory for regulation. And the third one is the Northern Emirates. So imagine within this country, relatively small country, we have three almost independent three healthcare regulators, each of which they have their own policies, regulations, and even opportunities. So that make life a little bit complicated for companies to navigate those three ecosystems at the same time. Sometimes there'll be some differences in policies and regulations. But as I said, it's also create three opportunities for every company.
Right.
Another issue that we still moving from fee to service healthcare domain to value-based care. And this transition is a little bit complex. However, this is also bring some opportunities for companies to wants to fill in those gaps between fee for service domain and a value-based domain. So that's also a key issue. Maybe another challenge is sometimes it will be a little bit tricky to find talents from UAE. I mean, from UAE citizens. Still, we don't have the right, I can say, the enough supply of talents in digital health in particular. And the reason for that, that we don't have bespoke, I can say, university programs focusing on digital health. And most of the companies who wants to onboard Emiratis or UAE citizens, they need to invest again on them to bridge the gap between the university outcomes and the real needs for digital health.
You mentioned the complexity of this, bureaucratic machine. So I may imagine a company entering this space it's a good idea for them to actually partner with some local agencies or whatever. Do you have a framework for kind of onboarding new business in the region,
So
like
as I said,
partnership?
every healthcare regulator, they have their own onboarding approach. So I can give you one example, like in Abu Dhabi, they created a platform where it's called Hub 71. So Hub
Mhm.
71 is a place for startups that can be selected, and they will be having a branch in it could be kind of an accelerator. So this kind of a way to onboard those new startups and vet them, and the ones who are really prove their capabilities, they will be embraced by the government or the private sector in Abu Dhabi. In Dubai, we have a little bit different approach on that. So we have an organization called the Dubai Future Foundation, and they build some sort of annual cohorts of startups. So it's a little bit different from one healthcare system to another. Yeah. And
Mhm.
each healthcare system, they have a little bit different direction. So if you can see in Dubai, they are more, I can say, influenced by private sector, comparing with Abu Dhabi, which is more influenced by the government. So they are moving in different speeds. However, they complement each other.
In terms of like, I can see that the digital ecosystem, like in terms of software, all this kind of stuff, is very strong in the region. What about the actual fundamental low-level hardware infrastructure, like
No,
servers and
that
local?
that's we have the state of the art. So as we speak today, all the key players in for example, cloud infrastructure, they are already here in UAE. So we have Azure, Microsoft, we have AWS, we have Oracle, and maybe Google is coming. So we have mega company, I mean local companies who are really investing in digital infrastructure. So we have Etisalat, which is the main telco company. We have Do. So we are talking about the infrastructure. We have 5G network since like maybe 4 or 5 years ago. So we have the state-of-the-art infrastructure. And as I said, the leadership, this was one of their first mandate is to make Dubai from the infrastructure point of view is the best place on earth.
Great. Uh, the next question, I guess, very interesting for those who listen to us, is this: as a leader of this community, as a sound representative of this community, what kind of companies you would welcome? Like, what Dubai needs right now, and what are the greatest opportunities, the
Yeah,
low-hanging fruits
so we're
for?
speaking mainly on digital health. So I think all startups who are using new technologies like AI, generative AI, how can I say that, synthetic data to support moving from a fee-for-service system to value-based system. And that's
Mhm.
by also, for example, codifying the best clinical guidelines to support doctors to make sure that they focus on what they need to focus on and try to disseminate the other, I can say, tasks and efforts to other employees within the healthcare organization. I think making the most of the doctor time, the specialist time, and delegate other activities to the others, and that for sure will be the key factor in lowering the cost of care. So 90%, I can say, guarantee 80 or 90% of today's healthcare costs can be eliminated by disseminating some of the tasks of doctors to other, I think, employees like nurses, like, for example, healthcare champions, even sometimes call centers. And you can do this through AI technologies, for example. So we can provide those AI technologies to support those employees to make the most of the doctor's time. So anything related to collaboration, coordination, even making the patient as center of care rather than making the physician as the center of care. That all these technologies are really needed. So I think that's the most important.
I know regarding this, I know, let's say in the United States, there is a very big push against, sometimes it's a push against new technologies, like people are afraid about that diagnosis being done by AI because of, possible mistakes or misinterpretation or hallucination of the systems, etc. How do you view this? Is it a concern among the public
Yeah,
in
yeah,
the
it's de facto concern, and we are trying our best as part of the government to even leverage our talents and skills to be able to vet those technologies and to register them and notify if there is any misbehavior, any diversion of the results of this AI technology, making sure that we treat the patient safety as a first-class citizen. That will keep the trust of our citizen to these kind of AI gadgets.
It's very good to be a citizen there, I assume.
Yes.
Well, my question is this: how do you see the future of digital health ecosystem, let's say in the coming year or maybe in 3 years, where things are moving forward?
Well, I think within maybe the coming 2, 3 years, clinicians who don't believe in AI will lose their jobs. I agree with that. So yes, we still need good clinicians. We need to get smart clinicians, but still we need to augment them with technology, with AI, to make sure that they don't miss things, make sure that they are يعني, following guidelines, uh, feeding the system again with their knowledge. That's very important. This conversation between AI gadgets and smart doctors will always be needed, and every technology that can support that, it will prevail for sure.
So, as I see AI in this, especially this latest large language models like ChatGPT or specialized healthcare focused models, they're essentially a great way to expand to scale expertise. So, if somebody
Exactly.
possesses
And
expertise, you can
also, and
scale.
also, it empowers patients, which is also much needed. So even today, we feel that most of our patients are disengaged, even they are not part of their care process. The more
Uh,
you engage them, the more you empower them, and I think يعني, these new technologies around generative AI will play a key role in even leverage the conversation between doctor and patient and leverage the empowerment of patients to take actions, positive actions to be more healthy.
So it's essentially it's a kind of a learning loop. The doctor
Exactly.
essentially learns more from the patient about the
Mhm.
patient, and patient can have
Exactly.
also some
Exactly.
control of what's going
Exactly.
on. Uh-huh. It's very interesting. Uh, well, what? probably the last bit of questioning is about your personal vision for the region, for the world. I don't know, some wishes for this year. How do you see the world evolving from
Yes,
here?
I'm watching very closely what's happening in Saudi as well. So they're moving very fast towards digital health, and they are investing a lot. And we see some interesting projects that I wish that we have also in UAE. So, for example, they have a project called Sandbox for healthcare. So this is a clear pathway for startups to join the system. And the good thing about what they have done, they brought together all the regulatory bodies who would be anyway touching any kind of a digital health startup. So they put them together in all in this one infrastructure, like one body, one building, one community, and then
Mhm.
you as a startup, you start your journey with them at the same time. So it will be very easy for you to eliminate any discrepancies around your business model, around your technology aspects, your AI algorithm. So you'll get approvals from everyone at the same time. And this will shorten dramatically the time to market for them. I think this experiment is worthy of looking at and maybe copying the يعني the say يعني the coming say month 6 month or 1 year.
Mhm.
So
Okay,
I'm looking
so
into this experiment with admiration.
it's great to have something going. And yeah. Uh, yeah. So basically, with that, I'd like to thank you. And yep, I hope to see you again in person during the upcoming meetings. So
Inshallah,
yep,
inshallah. Do you have any plans to visit Dubai soon?
I think so. I think this year I might be coming, but let's see how it plays out.
Okay, so maybe you can mark 6th and 7th of November. That could be a good time to visit Dubai as we will have our event at that time.
Okay. I will try to figure out the planning. Thank you, Osama. Bye bye.
Okay.